3 weeks into the rollout of the Social Health Insurance Fund, SHIF, the promise of accessible quality healthcare remains elusive for many Kenyans, casting doubt on the system's ability to deliver on its lofty ambitions.
Mgonjwa last week, nikaenda wakaniambia you have to pay. Kwa sababu hiyo haiko kwa system. Nikashangaa na nikalipa nikatoka huko.
Haina haja mtu asajili kwa hii kitu kwa sababu haina mwelekeo na haitakusaidia. Watuletee kitu ambaye kinaweza ikatusaidia.
Low-income Kenyans are set to feel the pinch, with SHIF deductions climbing above 2.75% of their earnings, and a minimum contribution of 300 Kenyan shilling, a heavy burden for those already struggling.
If you are 2.75%, the amount falls below 300, you will pay 300. Nobody pays below 300. So if you are 2.75 was coming to 100 shillings, you'll have to add 200 more. You'll have paid that times 3. That will be 7.5%. So the poorest in the society are the ones paying the highest percentage.
Kama mwananchi wa kawaida tutaumia kwanza before mtu ashike laini itakuwa imetumisa.
As the first round of deductions hits employed Kenyans, doubts are rising about whether SHIF can truly match the service quality of the now replaced NHIF.
And even the 2,000, the 10,000 you give, there is a rider, if you look at those regulations, that subject to availability of funds. So you can actually be told that we will not offer you dentistry services, we will not offer you ophthalmologic services, because the budget is not there. Where is the budget coming from? The budget is coming from parliament.
Nilikuwa na mtoto akamesa pesa. Kwenda pale hospitalini nikaambiwa niende niregister kwa SHA. Register saa ngapi kwa SHA ikiwa mtoto wako alimbani.
Clinical Practitioners Union Chair Peterson Washira has openly criticized the government's lack of consultation with key stakeholders, saying this oversight has led to confusion and disrupted basic healthcare services under the new system.
The money that Kenyans are contributing, you will only access it at level 4. What does that mean? That means that if you are going to level 2 and level 3, and probably you do not get admitted, you will never utilize what you are contributing. You'll have to chip out of your pocket to pay for level 2 and level 3, yet you have contributed a lot of money that you will not utilize under level 4, level 5, level 6.
Unaambiwa kwa akaunti yako haina kitu, sasa mpaka utoe pesa cash utibiwe. Sasa ndio tunashangaa kwani hii pesa ilikuwa kwa NHIF hai kurudishwa upande huu mwingine.
The situation could worsen if health facilities registered under the Clinical Officers Council are excluded from SHIF's network of providers, further limiting access to essential care.
You have to take the Clinical Officers Council to comply with the law, and to take a KMPDC one to comply with the SHA, which is outside the act. And that is why we are saying that that is an act of corruption. The providers, they deliberately do not want to join SHA because they feel that we have already been failed. It has been too long before we have been paid what is owed to us. And so we simply do not want to get into this until they settle what they owe to us.
While the High Court has given the green light for SHIF to continue, there is growing pressure from stakeholders to fix provisions that clash with Kenya's constitution and legal framework.
Do you decide? Do you sit down in your house and decide who is going to fall sick and which sickness will require probably for them to go to India or another country to seek medical attention? So that is not in line with the aspiration of the Constitution. It is not in line with the provision of the Health Act. It is not in line also with the same SHA Act.
Despite these challenges, President William Ruto has reassured Kenyans that technical hitches in the new healthcare system will soon be addressed following consultation with leadership of the Social Health Authority. Mariam Jahid, K24 Nairobi.